Diamonds in the sunset, now your time has come.
All right, 5 minutes after 11 o'clock. Beautiful Thursday morning. Robin, do you remember the TV show Make Room for Daddy? Remember that show?
I sure do. I love that show.
Yeah, I don't know how many people remember that. Danny Thomas was the star. Nobody in the room remembers that stuff.
You do?
But you remember Make Room for Daddy? Okay, well, Danny Thomas, as you know, was the star. And if you might remember, if somebody said something that would kind of get to him, I guess is the best way to say this. They always said it while he was taking a sip of coffee, and he would always spit it out. You remember this? He'd be one of those, he's sipping a cup of coffee, it just sprays everywhere, right? Well, I have a feeling, Robin, that if I'm at Thanksgiving dinner or any gathering, and somebody's drinking something, I can probably get that same reaction just by saying these words. Are you ready? Aging reproductive system. I can just imagine Danny Thomas spraying coffee everywhere with those three words.
That's right.
Well, that's what we're talking about today. Am I right? Am I right? Yes. Okay, we are. Okay. Deb Dougherty is in the studio, and Kristy Paquette. Am I saying your name right?
You are.
Am I saying everything right? Okay. And let me just tell you what we're doing. Deb is an advanced registered nurse practitioner with advanced urology. And Dr. Kristy Paquette is a doctor of physical therapy with Strive Physical Therapy. We are talking about women's health, pelvic floor issues. The only word I know is women. And also at the other end of the room, let me make sure I make sure you know that Leah Caruso is here, as is Brittany Marthaler. So, ladies, thank you for bringing us some wonderful guests, as you do.
Thank you for having
all
us.
the time. All right, so good morning, ladies, Deb and Dr. Paquette. Are you both doctors? Should I say doctors to both of you? No, okay. I guess my first question, and I asked Robin this morning, and she's the lady, so she should know this. What is the pelvic floor? What is that?
That I don't know. I mean, I'm good at my own anatomy, but I'm not sure about all the
Yeah, where is the floor?
particulars.
How come I don't hear anybody? Did I forget to turn on the microphones, or did nobody say anything yet?
The pelvic floor is
Oh, there you are. Okay.
what holds it up for women. It's a group of muscles
Where are you?
that are in the pelvis, and it supports your bladder, your uterus, and your rectum.
And we don't have that? Guys don't
You
have that?
do have
Oh,
that.
we do have a floor.
Yes.
Okay.
Men can have pelvic floor disorders too,
Oh, okay.
just not as common as women. It's usually after surgeries for prostate.
Oh, okay. And women have the problems more because they give birth? Is that?
Correct.
Okay.
There's several risk factors. Age is one of them. Vaginal deliveries. The more vaginal deliveries that you have, the more overweight that you are. If you smoke, ethnicity. Caucasian women are much more likely to have pelvic floor disorders.
Why is that? Why? Is there a
It
reason?
has to do with bones and ligaments, which I'm sure she could get into. If you have a lighter bone mass, you have a weaker pelvis. And lastly, if you have a job that does a lot of heavy lifting,
Oh, okay. So
anything that puts pressure on the pelvic floor.
And that would be
weakens
for
it.
both men and women, or just women?
Usually just women.
The heavy women, the heavy
Yes.
lifting thing. You know,
sure you'll hear
you were
about that.
giggling, weren't you? When you knew you were bringing this topic, you ladies were giggling. I know he's going to be stumbling over every word. Do you know, last week on the Horse Show, I had the word semen said more than any other show I've ever hosted. I never heard the word semen so much on the broadcast. I have a feeling today we're going to say the word vagina a lot, right?
Yes,
Aye.
sure.
Okay. 2 shows in 1 week. All right.
Well, women tend to have an extra opening, since you brought up the vagina word. Men don't have that particular opening, and so we're more
No.
at risk for gravity and the forces of nature.
Okay. Do anything else I need to know about that?
Not on this show.
All right. So obviously this is very serious. So what are we talking about? Pain? Is there pain involved with this?
You can have pain. You can have leakage of urine, leakage of stool, inability to urinate at all, inability to move your bowels at all. And in
that's
some
not
women,
good.
everything falls out of the vagina and it just completely comes out, and that's pelvic organ prolapse.
How do you remember Danny Thomas? You're not old enough. You don't look old.
I really am old enough.
Okay.
If a woman is experiencing that kind of leakage, should she go to the doctor right away, or is there something that she can do to take care of it on her own?
Well, there are many different causes for the problem. So, seeking a professional assessment is always a great place to start. So, you may be having leakage from recent childbirth. The weight of the baby and the process of birth stretches everything out.
I was a huge baby. I bet you my mother had that problem.
She may have.
She never told me, but yeah.
But see, women don't talk about it because they're a little embarrassed and they don't want people to know that they're wetting their pants or that they have to wear a diaper or some kind of pad to absorb the urine. And so it's really debilitating in that people stay in their houses and they don't go out and socialize, or they have to plan their trip. I'm going to go from my house to Walmart, so I need to know exactly, where the bathrooms are, and I can't get too far, and it's really consuming. It will consume the women's thought process.
But that's fixable, right? Isn't that why we're talking today? So the ladies will know that this can be fixed? Okay.
Exactly, yes.
Men are bombarded with commercials for prostate that I've often wondered, are they even true? And it's about supplements and that.
For the record, they're not true.
They're not true for the men, but are you ladies getting the same kind of messages? Like, here, take this vitamin or this powder and you'll fix the problem?
Oh, well, and there's a lot of commercials for bladder control and things on the television.
I mean, I can understand a device, an absorbent device or something like that. I can understand that. But I mean, are there, I don't know, if you go to the health food store, is that lady going to tell a lady, this is what you should take for that problem?
Absolutely.
Yeah.
There is.
Yeah.
But is she telling the truth?
And there are some complementary and alternative medicines that do work for things like urge incontinence, but it doesn't really work for stress incontinence that we're talking about.
Oh, okay. And that's a big
There's
difference.
two different types of incontinence.
Okay.
Urge is when you feel like you got to go and you got to go right now, and that's usually the message from your brain to your bladder gets haywire, and it's constantly telling you need to go when you don't. And the other one is stress incontinence, where the support systems that usually hold the bladder up in place are weakening, and you no longer can control your bladder, and that's not really treatable by medication. It may offer a little bit of help, but it's really not the treatment for stress incontinence at all.
So when there's like an exercise expert on, he or she will always say, strengthen your core. If you strengthened your core, would that help the problem?
Yes and no. The core is, the pelvic floor is part of the core, technically. So, yes.
Okay, so exercise.
Right. So back to the scenario where you just had a baby and you're stretched out. You may have had surgery. The episiotomy word. That word always terrified me.
What is the episiotomy word? What's that?
Should we tell them what an episiotomy
That's
is?
Does everybody know but me? Do you know?
Well, you probably
No?
wouldn't,
Good.
because you wouldn't have an episiotomy, but that's where they use a pair of scissors to cut down there to allow for the passage of the baby's head and shoulders.
Oh, probably happened. I had a big head too.
I'm sure your mom probably had that.
Your
He
poor
was over
mother.
10 pounds.
Oh, my.
Right.
How do you know that?
Well, your mom told.
Yay. All right.
So there's been tissue damage. And so through the healing process, what I do as a physical therapist, I work with bones and joints and movement and function of the human structure. So I work with the muscles of the pelvic floor, and we work on strengthening those. Yay, Kegel. So a lot of what we do is, exercising and strengthening, and much of the battle is helping women find these muscles. I don't know how many times I've had someone working with me for 20 or 30 minutes just to get a contraction.
Really? So what do you do? I mean,
They're so disconnected. We're so disconnected as women from.
So what do? You tell them to
down there.
flex that muscle, and they try, and that's not it.
Absolutely. They're squeezing everything but the.
And how do you know when they've hit? Do you have a green light or something?
I use digital examination.
Oh.
Oh, your hand. You
Yes.
touch it.
Yep.
Really?
Absolutely.
And you can feel it.
Yes.
And when they finally hit it, what does that tell you?
Well, that's the start.
That's like playing a musical instrument.
that's
Oh, I
the
can play. I couldn't reach that note before.
Right. That's the start of getting the strength back and getting the control back.
Wow.
Is learning how to control your muscle.
And then are they doing it all the time? Like if they're driving the car, I'm doing it, I'm doing it, I'm doing it.
Absolutely. I encourage as much as
So this
possible.
is an easy exercise once
You won't even know.
Oh yeah, we could all be doing it right now,
now.
and you wouldn't know.
Holy mackerel. All right. All right. Wow. So when you're talking about birth causing some of this, that's a young woman. That's not an old woman.
Can be.
Well, it's never an old woman, right? Old women don't have babies.
Well,
No.
define old. I was 42 when my second one was born.
That's still young.
Okay.
No?
But the older you get, the worse
You're
off
over
these problems
42?
are.
Okay.
So this is all for, this is even for postmenopausal.
Absolutely. That's
right.
probably more what she probably sees, I would think.
It is the more.
The older a woman gets, the greater the increase. It's a 1 in 4 risk overall for women eventually developing some form of pelvic floor disorder, and 1 in 11 of those women will need some sort of surgical intervention when everything else fails.
So I guess the reason I started with the young woman observation is that is it possible that a young woman had something started at birth, when she gave birth, but really didn't have a problem with it until she was older?
Oh, most of the time, yes.
Oh, that is usually what happens. Okay.
She may have a little bit of incontinence right after delivery, and we usually tell them that's not uncommon. And it's when it becomes such a problem that it interferes with their life that they'll say, you have got to do something. I can't even pick my son up without wetting myself, that we would refer out and have her make some suggestions and
Oh, wow.
And after menopause, your estrogen levels change. You find your muscles weaken, your joints hurt, your everything. You don't build muscle strength as quickly as you did when you were younger, and so these problems tend to then manifest themselves, in a more urgent, pardon the pun, manner.
Yeah.
So
That's the typical patient that I would see.
Are you okay with allowing listeners to ask questions in case
yeah,
there's one we
please.
don't have?
Absolutely.
Okay.
Absolutely.
If you have a question, this is a great time to call. Please excuse my silliness. It's just the way I am. The phone number here is 622-9622. Deb Dougherty is here. She can answer your questions. And Dr. Kristy Paquette is also here. And we're talking about women's health in general, specifically pelvic floor issues. And maybe there's somebody out there with incontinence and you never thought this could be what the problem is. Does that ever happen? They just don't know? It never occurred to them?
Many times I've met with women who have been to 6 different doctors, right? They've been to their primary care, who sends them to the urologist, who sends them to the gynecologist, and they've had this test and that test, and more commonly with pelvic pain issues.
Mm-hmm.
It's all in your head, or it's coming from your back.
Oh, don't you hate that all in your head?
Dude,
Nobody wants to deal with
The mechanic told Robin that
pelvic
about
pain.
her car. She's been driving for 40 years. They said it's all in your head.
Yeah.
How could somebody, you've living in your body for a long time.
Right.
How could it be in your head?
you're still feeling the pain. Exactly.
Does a woman who has had an hysterectomy, is she more apt to have these kind of problems?
I don't know that it's cause and effect, but I certainly, do work with a lot of women who've had hysterectomies,
I would say,
who've had the sling surgeries, the mesh, or,
Yes.
any of that type of surgeries. Absolutely.
Without trying to put you on the spot, but I have a feeling this question might. But is there a percentage, what percentage of women who have these problems can be completely cured, or is that a hard question?
Well, no.
Just a ballpark
From the
figure.
physical therapy side, there have been research studies that have shown, with the stress incontinence, the weakness, when you cough, you leak, when you pick something up heavy, you leak. After having physical therapy and learning the exercises and doing them effectively, that's the key, doing the exercises effectively, they've had 70-80% cure rates. I mean, improvement in symptoms. Absolutely.
That's good. That's a good high number, right?
Mm-hmm.
Yeah.
How about the women who do the birth control that have the devices placed inside?
The IUD
Yes.
type? It shouldn't affect.
Doesn't
It
affect
doesn't
them,
affect
no.
it at all?
No, because the muscles that we're working on are more external. They form a sling across the bottom of the pelvis, and the IUD is actually within the uterus. So it's two separate structures, and it really should.
Oh, so it doesn't interfere then
No.
with the muscles?
Absolutely not.
So typically, the average patient is older, but the problem started when they were younger. Oh, not always
necessarily.
Okay.
No, I mean there's such a there's a wide cause for these symptoms, whether it's pain or incontinence, urgency. We might be working with someone who was in the hospital who had a catheter, and if you have a catheter, then you're not exercising those muscles. You're just letting it go right into the bag, and so the muscles forget what they're doing, and so it's all a matter of just retraining.
Oh,
So
it's kind of like when
that
you
could be
don't
any
walk,
age.
like when you're in bed for a while, right? What is that called?
Atrophy.
Atrophy.
Absolutely. And the brain is one of the most important organs, because if you can't make that connection with your brain, then you can't use the muscles.
So if the pelvic floor is supporting everything, we've kind of focused on the reproductive organs, but are the other organs also affected? Are they drooping in there? As a kidney and the liver and all that, are they having problems also?
No.
No.
Well, if you have a rectocele, which is where the posterior muscle of the vagina weakens and comes down, you can have a rectocele where the rectum prolapses, not physically in the vagina, but pushes the muscle in the vagina, or the interocele where the whole top comes apart, and then your intestines are bearing down on that.
Oh.
And that causes a lot of issues with trying to have a bowel movement. These women can't because there's no muscle there to squeeze it out.
Doesn't rectocele sound like something you'd find at Home Depot, though?
Oh, yeah.
Can I help you? Yeah, do you have any rectocele?
Do you have the kind that you can paint?
Yeah, right. How about the women that have those bands and things to lose weight and have those kind of surgeries? Is that going to affect
the lap
it
band?
at all?
Or
Yeah.
the stomach?
Yes.
No, well, the stomach is higher up in the system, and it doesn't really put pressure. Those surgeries don't put pressure. A lot of these issues, the obesity, the pregnancy, it's increasing the intra-abdominal pressure. So what you're doing is, it's like a balloon. If you have a balloon and you squeeze the top of it, you're putting more pressure down on the bottom because you're pushing the air down. And that's kind of what we're talking about. That baby is pushing down. Gravity is pulling it down and stretching out those structures. So, the lap band, that's a surgical implant onto the stomach itself.
So
Well,
if you have
that
these
won't
problems, you stay away from roller coasters and things like that? No?
Maybe the Tower of Terror or something.
Yes. Yeah, definitely. Yeah, that bottom falls out for sure.
Yeah, you might need to change your pants.
If you
Yeah.
ladies will put the headphones on, we have a phone call. Somebody has a question for you. And there you go. Good morning. Thank you for waiting. You're on the air.
Yes, good morning, everyone. Can a female that's been very strong in sports all her life, from way back in the teens to her middle age, be afflicted with this problem?
Absolutely. Sports, you tend to focus on the big muscles, right? So you're working on running faster or lifting more, and it goes back to the core conversation we were having. You might exercise, you might do sit-ups, you might strengthen your stomach, but you're not strengthening your pelvic floor. So, and that added stress of, running or lifting, grunting when you're exercising, that's putting more pressure down on the pelvic floor. So, yeah, absolutely, that can be certainly a determining fact.
Thank you.
All right. Thank you. Yeah, but can they continue to play sports? Would tennis be a problem? Not you jumping around and.
Oh, yeah, absolutely. One of the things we work on after we help the patient to identify the muscles and be able to strengthen them, then we start confusing them by adding activity. So we might start doing squats while you're doing your Kegels, or we might,
So you do that on purpose?
we
to
do it
kinda
on purpose.
Get them ready for the real world,
Right,
or whatever.
right,
Yeah.
right. Because when you're emptying your dishwasher, you're bending over, you're picking things up.
Yeah.
You want to have control. So then we start introducing exercise with the Kegels.
You haven't touched on nutrition. Is that a huge, huge factor for the woman to keep that pelvic floor in check?
Overall, health in general and eating well is going to contribute to the factor. Deb touched on obesity and how that extra pressure can put a lot of strain on your bladder and cause incontinence. And that is a factor, absolutely. I've seen a lot of people who come in for the lap band surgeries in the hospital that have that diagnosis of incontinence. And so, absolutely.
Maybe they didn't consider getting that checked, huh? Maybe, like you said, they're too
absolutely.
embarrassed.
Right.
So, Deb, are you the first person that a lady would see?
Yes.
Okay, and if somebody's listening right now and they're relating to what we're talking about and they want to know what to do, do they call you or?
Yeah, they can call and make an appointment with me. I work for Advanced Urology Specialist. I see patients in Ocala and in the villages, and I see a lot of their women with this problem because most of the time the women don't want to go and talk to all of our men doctors about these very embarrassing issues.
I don't blame them.
Yeah,
I'm glad there's lady doctors. So is it always surgery that corrects it?
No.
Maybe you've kind of said this and I just didn't
surgery
absorb
would
it
be
yet.
our very last resort. There's lots of things.
So the therapy
absolutely.
is... Okay.
Diet modification, decreasing alcohol, smoking cessation, losing weight, and doing the super Kegels, getting into a pelvic floor. The last thing you want to do is to send somebody to surgery, especially if they're in a really advanced age. I see a lot of women who are in their 70s, 80s, and even 90s with this, who it becomes the most consuming part of their life. And one of the main reasons why people end up in a nursing home is because their family can't deal with their incontinence.
Oh.
They can't put a diaper on it? I mean, that's
They
crazy.
don't want to, and the more times...
Oh, they don't want to
Yeah,
themselves.
family members don't want to, and there's also an association with the more number of times that you're incontinent or get up during the night, the greater likelihood you are to fall and have a fracture. So they've been done studies. There's absolute links between incontinence and death because these people break their hips and end up going, to a nursing home, and then they end up...
Oh, really? No, that's too sad. We do have another phone call. Good morning. You're on the air. Thank you for calling.
Good morning. I was wondering if insurance covers this therapy.
Yes, it does. Most insurance will cover physical therapy, and this is just a specialized form of physical therapy. So definitely Medicare and most of the major insurance carriers.
Advantage plans?
Yes. Yes, as well as the Advantage plans.
There you go. I think we heard you enough. Okay. Well, thank you for that question because that's an important part. So I want to make sure that the listeners know what path to take in order to get these problems addressed the right way. What would you suggest? Is there a phone number, a website,
I would say, first of all, have this conversation with your primary care provider.
Okay, go to your doctor first.
And see if they feel like you're an appropriate referral to an OBGYN or a urologist, depending upon what the problem is.
Okay.
But I'm assuming they could make direct referrals to you if they have the issue, correct?
They could, absolutely, yes. It's always a great idea to get, make sure that there's no infections or some other things that might be triggering this. So, getting a checkup from your doctor is always a great idea.
And Ocala Health has the consultant nurse hotline. Is that a good number to call for people if they have these questions and they'll refer them to the doctor?
Absolutely. The number is 800-530-1188, and you can connect with primary care physicians. We have a group of specialty primary care physicians called family care specialists. And you can also be connected with a specialist as well, urology, gynecology, anything that you may need. And they can take it from there.
Okay. All right. And say the number again, Brittany.
800-530-1188.
Okay. Thank you for coming in, ladies, and I hope I wasn't too silly.
Oh, thank you.
How about I did? Okay. Deb Dougherty. Thank you. Dr. Kristy Paquette, thank you. And at the end of the table, Leah Caruso, good to see you again. And Brittany Marthaler, thank you, ladies, for what you do. Call us if you need any of that repeated, and we'll be glad to do that. Plus, we are putting these... Oh, my goodness, I have the camera way over there. Let me put the camera back. It's hard to be a radio guy and a cameraman at the same time. But thank you for doing what you do. And I was just going to say that this video will be online by the end of today, okay? Phew. All right.
Yes.
Thank you. We'll take a little break. We will be right back.
Fox News.